Welcome to Infectious Laughter Podcast.
Hosted by nurses, where real, ridiculous, and relatable moments from working in healthcare are shared.
We respect HIPAA because it's real, and we like our licenses. Now let's do this with culture and sensitivity. You ready to start, Nancy?
I am.
Welcome back for another podcast.
Welcome to you.
Thank you. Thank you. I think our working title is The Names We've Been Called.
Yeah, and there are many.
Yeah. I was just reading this morning in my extensive free time a discussion board that was talking about, are you insulted if a patient calls you nurse? Like they just yell out like, nurse.
No, why would you be? If they can't remember your name, it's better than a lot of other things they could call you. Right. And it is your title.
Right. But some people were like, oh, well, I am a nurse, but if I give you my name, you should use my name. And I thought, wow.
Yeah, no, that seems awfully sensitive. I mean, what are they supposed to call out if they don't remember your name? And not everybody's going to, because some people don't have good memories, and they may not be able to see the whiteboard in the room,
or the board's not updated.
Well, we know that never happens.
Not where we were.
So what are they supposed to call you? Although I had a woman once. I was sitting at the nurse's station, and I hear my patient yell, "Hey, you old hag, get in here!" So I went in and I said, you and I are the same age. She just laughed.
Oh, it was a lady that called you an old hag. And you knew she was calling you. And
it was coming from one of my rooms. So I figured that's who she was looking for.
Wow. Did she call you an old hag again?
She may have. She was, an old broad.
But you were the same age as her.
Yeah, I don't think that mattered.
Maybe you weren't the same age medically speaking.
Right.
Right? Like if someone can be, pick an age, 65 and healthy versus 65 and multiple medical problems.
I think she probably had special nicknames for a lot of people.
Oh, nice.
She was, just kind of
That was her. Yeah.
It was just her personality.
Yeah. Man, to be a fly on the wall at her house.
Yeah. I also had a patient, she was elderly, her sister was at the bedside, and she had oxygen on, an oxygen mask, not just nasal cannula. It covered her face. And with it on, through the mask, I heard her call me a bitch.
Oh, she called you something that rhymes with Mitch.
She did. And I didn't take offense because, I don't get upset about things. And her sister assured me that I was not the only one that she ever called that name.
Right. So was she using it in context where she's telling her sister a story and she was
no,
like
she
that?
wanted me to take the oxygen off of her. Yeah.
Like, hey, you, beep.
Yes.
Do this.
Yes. But she had the mask on for a reason, so I had to explain to her that was not possible, and that's when she called me the name.
Yeah. And obviously the reason wasn't to muffle her.
Because that didn't work. But her sister assured me that was, not uncommon for her.
This was normal discussion.
Now, and both of these patients, mind you, were alert and oriented. I've had patients who were confused call me,
all kinds of things.
Crack whore, get out of my house.
Crack whore, get out of my house.
Yes. Confused gentleman. And I was just like, I've been called worse.
I'm wondering if this old man had an experience with a crack whore, or he watched certain TV shows.
Maybe I looked like a crack whore he knew.
I don't know, right?
Yeah.
Right. When my dad was really confused, stuff came out of his mouth, and I don't know how he put all those words together. Yeah.
I have a theory that pleasantly confused little old people were pleasant in their normal life before they were confused. And the more cranky people were probably cranky to begin with.
Right. That's what we're assuming.
Yes. I have no basis for this theory. I have not done any studies on it.
Right. Well, that would be really hard to do. To say like, all right, I'm going to follow you, pleasant individual, for the rest of your life. And if
you could
happen...
ask family, if they were they always this cranky?
Well, and if they're in pain too, and they were very pleasant, your reserves are gone and your inhibitions are gone. Yeah. All right, crack whore. What else were you called?
Oh gosh. I remember there was a guy who was SIWA, which we've talked about before. That's alcohol withdrawal. And we were having to get him into restraints. So there were several of us around the bed trying to get this gentleman to lay down and put restraints on him. And I know I or someone else asked him, do you know where you are? Because that's a common question to find out if they're oriented. And he said, yeah, I'm in jail with a lot of fat guards. So that's not calling us anything, but, you just have to kind of laugh.
And I know, so, like, we'll say a patient is SIWA, is alcohol withdrawal.
Yeah. I think it stands for Cincinnati something withdrawal from alcohol. It's a protocol.
Right, because I was just going to say, I don't even think I can come up with what the CIWA stands for.
I know C is Cincinnati because that's where it was.
That's where alcohol withdrawal was started, Nancy. It hadn't been anywhere else before that.
It was some hospital in Cincinnati that developed the protocol.
That is not as funny as what I said, but yeah. Yeah. Well, when I was at bedside as an RN, my patients were nonverbal because they were neonates.
Oh, right. Yeah. So they probably didn't call you names. Or maybe they did in their language.
Right. Sure. I mean, their parents talked, but I didn't.
I would think most parents in that situation are scared, grateful, and they probably don't call you names.
Yeah, I don't remember having any of them call me a name. I remember I had one mother was very upset because the nurse on day shift would leave the baby laying on, I don't know, it was a little baby boy, his left side all day. And you're supposed to, turn them side to side, not just to reduce pressure, but to help their lungs develop. And then during your shift, you would mark on, this is back in the paper days, if the baby's oxygen went down, and you had to either stimulate them or just keep an eye on them. And so, of course, on night shift, I was turning the baby as I was supposed to, so he was desatting more frequently. And the mom would kind of yell at me that I was not caring for her baby.
I see.
But she never called me a name. She did end up requesting not to have me. But I had told my charge nurse, I said, I'm going to do what's best for this baby.
Sure.
She doesn't like that, and she's not willing to hear the reason why. And the day shift isn't explaining or even doing the right thing. What am I going to do?
Do you, now that you're a nurse practitioner in a specialty and you go from room to room, have you had patients call you names?
Well, we had my Cindy Crawford story earlier.
Right.
A lot of patients will call me doctor. They'll say, thank you, doctor.
Because you wear a lab coat.
Right, and I'm diagnosing, I'm explaining, I'm doing all of those things. And so I will always say,
right,
I'm not a doctor. And they will frequently say, well, you're a doctor to me. And my response is, well, they don't pay me the same as a doctor.
Right.
Occasionally, the office staff will call me Nurse Practitioner Waddell.
That's a mouthful.
Which is a lot. And so I'm like, guys, I introduced myself as Cindy, so just call me Cindy.
Right.
I'm not holding some power trip on my title or whatever. And for me with physicians, if they've told me, like, hey, call me, you know, Melinda or whatever their first name is, then that's what I'll do. But generally, unless they don't tell me that, I will call them doctor and then whatever their last name is, you know.
In the hospital setting, they're not in the room with the patient for very long. You know, we spend most of the time with the patient.
Right. But like if you were discussing the patient with one of the physicians, I mean, you've been at the hospital for a long time. Would you just, you know, be like, hey,
I call them doctor whatever. There's literally, I can think of 2 doctors right now who insist on just being called by their first name. And then I do.
Right. I've had very few do that. And the ones occasionally they'll, after years, be like, why are you still calling me this? And I'm like, well, I never was told that you were okay with me calling you by your first name. And so I'm going to defer.
Right. Now, a couple of times I've run into doctors outside of the hospital because I live near the hospital, and I think some of them do too. And then I just call them by their first name.
Yeah. I've had patients ask me, what is that doctor's name? And if I don't remember, I go, that's doctor. Like I just...
Right.
You know.
Doctor.
You mentioned, like, when you first introduce yourself, you'll say, I'm Nancy, I'm your nurse, Nurse Nancy. Simple to remember. Do the patients call you Nurse Nancy?
A couple of them have. Mostly it just makes it easy for them to remember my first name. But, you know, some patients they're more playful, you know, have a sense of humor.
Yeah.
And so sometimes, you know, I'll come in the room, hey, it's Nurse Nancy. Yeah. So, but mostly it's just Nancy. Yeah.
No, that makes sense.
It's just a way for me to get them to remember my name.
When I was reading that, when I was reading the thing I was reading this morning in my free time, one person was mentioning that there was this doctor who would call her girly.
Oh, yeah, that's not okay.
And so eventually she called her in free time.
If he had said nursey, that would be one thing, but girly is... I consider that disrespectful.
Yeah, it's kind of sexist and you know, kind of derogatory. Right. Even nursey kind of makes you sound like me. You know? I would as a young nurse, I don't know if I would have felt comfortable saying something. Yeah. But you get older and more comfortable with yourself, and and you're going to speak up.
And yes, you learn to stand up for, you know, yourself and your fellow young nurses, because they're still at that point where they are kind of afraid of the doctors and don't know really what the protocol is. But if I hear a doctor berate a nurse, we have a couple, normally surgeons.
Yeah.
Because they're very particular. But I will step in and defend my young nurses and say, we're all professionals on this team. You need to treat us that way. And they've backed down.
Just as some of the physicians think of us as helpers instead of fellow providers. Right. So I try to encourage, you know, just different language if possible. So there are times where I can't do my job without the physician. Right. So hopefully most of them see it, we're helping each other.
Right. So now when you round on a patient, let's say it's a new consult, you can write orders, you can place orders. Does the infectious diseases doctor then, must they round also?
Yes. At the hospital, the protocols, the standard of care is that every consult, the physician also sees the patient. The follow-ups at the hospital, I'm not required to have a physician.
I'm talking to the patient.
See the patient, and then I can bill. But frequently, if you're sick enough to be in the hospital, both of us are potentially seeing the patient. Sometimes just the physician provider, because we're running around doing consults or other things.
So would you be upset if somebody called out down the hallway, hey, provider?
That would be weird.
That would be very weird. I don't think most patients would think to call even their doctor, hey, provider.
No.
That's just not. So education-wise, nurse practitioners must have at least a master's, and I can go on to get a doctorate. You've been called. If you had a doctorate in nursing, would you be Dr. Nurse Cindy? There's a question as to whether people who are not MDs or DOs, which is a medical doctor or doctor of osteopathy, can you be called doctor? If you have a doctorate, legally you can use the term doctor, but I know now there's a question because people aren't, educated about this. Having somebody call themselves doctor has become kind of questionable because people think automatically that means you're a medical doctor.
Right. I think it gets confusing. None of the doctorate nurses that I know go by doctor. I was grandfathered in. I have my master's, but they were like, oh, I don't know, you've been a nurse practitioner so long, you don't have to get your doctorate unless you want to.
Mm-hmm.
And I wasn't about to go back to school. No, thank you. Although Dr. Waddell sounds like pretty decent, But I've had several say the only time they've ever been called doctor anything would be when they graduated. It gets very confusing for patients already, as we saw, without the whole having the doctorate. I did hear a physical therapist go in the room a few weeks ago and say, oh, hi, my name is, I don't know, whatever her name was. Hi, my name is Pat. I'm a doctor of physical therapy.
Yes, they require a lot of education.
They do, but when someone says they're a doctor of something, the patient, this patient looked at her very confused.
Right. Our chaplains often have a doctor of divinity.
Right.
I mean, there are a lot of doctorates. Teachers often get PhDs. You can get which is a doctorate of philosophy, I believe. There's also an EDD.
No, because that would be a PhD, philosophy.
No, a doctorate of PhD is a philosophy doctor.
What?
There's education. There's an EDD.
Oh, you're right.
There's a JD, Juris Doctor, which is what attorneys have. Right. All attorneys are doctors.
Opposing counsel, Dr. So-and-so.
Right. But a lot of people have doctorates.
Right. It's different. I feel like in the educational realm, like if you were teaching at the collegiate level or you were doing research or that kind of thing, then you could be called doctor. More commonly understood, who you are, what you're doing.
Right. In academia.
Right. Even at the high school level, I guess if the students know you have your PhD and you wanted that, you could do that. But that would be unusual even in a high school for me to call someone Dr. So-and-so.
Right.
It's just different.
Mm-hmm.
When you were saying Doctor of Philosophy, all I had is the joke about the PhD means pile higher and deeper. And so my brain completely spazzed. I was like, what does PhD mean? I just know it means you got your PhD. You did your dissertation.
But this is a current, I think I heard recently that they're actually considering legislation saying that unless you have an MD or a DO, you cannot, in certain circumstances, use the title doctor.
So, like a chiropractor couldn't call themselves a doctor?
I guess not, even though they're a doctor that's a doctorate.
Is it?
A naturopathic doctor has a doctorate.
No. Yeah.
It's complicated.
It can get confusing,
Mm-hmm.
So I just try to be as specific as I can with the patients and let them know, Most of them call me Cindy. Some will call me Cynthia because they look in their little app.
Mm-hmm.
And
because that has the medical record.
Because the hospital won't put a nickname as your name in the record.
Right.
So they'll call me Cynthia, and that's fine. Some of them, once I get to know them, I'll say, look, feel free to call me Cindy, because when I hear Cynthia, I feel like you're yelling at me.
Right.
I'm in trouble. Yeah. I hope you haven't been called like crack whore or anything weird recently.
No. I mean,
You don't even notice it. You're just like,
yeah, it doesn't faze me.
Yeah.
Once you've been a nurse for a certain amount of time, and especially I think now, having been a nurse 30 years, back in the 90s and the 2000s, things were kind of different. Unless, again, you have a confused patient.
Sure.
Then all bets are off.
Right. And then I think it's easier to be okay with that because you don't know, right? Is it pain? Is it a problem? And, these words are coming out that they've heard.
Right.
Like stuff came out of my dad's mouth that I didn't even know he would say anything like that. My dad never cursed ever. So it was really shocking.
And did he have dementia?
Nobody knows.
Okay. Because certain things happen to the brain in dementia, the Parkinson's, and it actually changes the brain organically, and it changes their personality.
Sure.
So.
Yeah. He just had this rapid decline that nobody could explain. Yeah. And so, but he seemed within a month as if he were a dementia patient. Yeah. It was very bizarre. So
there are some very aggressive, fast-moving. But again, it changes the brain chemistry and personality, and people who were, as pleasant as they could be become raging lunatics.
Right. So who knows? Who knows? I mean, I
never take it personally.
I have thought that if I end up with some form of dementia, please God, save me from that. But that watch out world, you're going to hear a lot of words.
Oh, yeah.
Yeah. Just
as a nurse, I not in front of the patients, but, in the med room or whatever, I've been known to drop an F-bomb, which kind of surprises the newer nurses who don't expect that of me. But, if I ended up in the hospital, I always tell the nurses, hey, if I'm a patient here and I get, crazy confused like that, just give me pillow therapy, which means...
No, Nancy. No.
Put the pillow over my face and let it be.
Yeah. No. So that you could yell into the pillow.
Right.
Sure, that's what
exactly
you mean.
What I mean.
Yes. But, it's true when you talk about, like, times changing and evolving. Mm-hmm. Like, I feel like when you look at old movies, there was this definite level of respect.
Yes.
A hierarchy, a very clear, all of these things, right? The tradition of the nurses wearing the little nurse's cap, which resembled apparently Florence Nightingale, and all of the first nurses were of a religious order.
Right. You had to be, yes, that's true.
Yes. Whereas when I graduated, I didn't have a picture, with a thing on my head.
Do they not do that now?
I don't know, but it wasn't a thing. And it could have been the school I was graduating from thought, this is not necessary. Some nurses I know were very proud to have that photo.
I have that photo.
And I was like, no, I was bad enough as a student. I had to wear all white.
I can't imagine. I have trouble staying clean even in, outside the hospital. To have to wear white uniform, stockings, shoes, and keep a hat on all day.
For what reason?
Well, it was...
Well, but today, hopefully there's a little more, there's some respect, but they know that we're there to help the patients. Yes. And, we don't want to be called crazy crack whores or whatever.
By and large, the patients and their families are very, very nice and respectful and grateful. Again, if they're confused, all bets are off. And some people, are just more salty.
I definitely have some who are just salty. Yeah. Salty, and they came in salty and they left salty, and that was all that was going to happen.
Right.
And they made no bones about it and no apologies for it. And
that's just who they are.
That's who, yeah. Yeah. So, but hopefully we all are kind to each other and, go from there, right? Spread kindness, not germs.
There you go.
All right, Nancy.
All
I
right.
think that's wrapped up another episode.
It is.
Congratulations.
Thank you.
And look, we have these new. We're filming differently,
We are.
and when nurses do editing, we don't know how this is going to work out.
We shall see. The hosts and producers of this podcast explicitly disclaim any liability or loss incurred directly or indirectly as a result of the use or application of any of the content presented. Educational or health-related discussions are meant for general information and entertainment only. They are not medical advice and are not intended as a substitute for professional medical advice, diagnosis, or treatment. Always consult your own healthcare provider for any medical concerns or decisions.
While we make every effort to ensure accuracy, we make no guarantees about the completeness, reliability, or accuracy of the information presented. Medicine is always evolving and content may become outdated.
This podcast may contain discussions of medical procedures or topics that some may find sensitive. Listener discretion is advised.
And most importantly, we laugh with our patients and coworkers, never at them, because nursing is serious work, but it comes with seriously funny moments. Oh, vanity.
Yes.
Okay, so we're going to have to clap at the same time
Okay.
so that all the images show us clapping,
Okay.
right? So episode, we don't know what we're on. We're just going to clap like 1, 2, 3, clap. Okay.